Recent actions by the Trump administration have spotlighted allegations of fraud in Minnesota's child care assistance programs. The Department of Health and Human Services has temporarily frozen $185 million in funding while introducing new verification processes for reimbursements. This move comes amid ongoing state investigations and increased public scrutiny following a viral video. According to reports, the Trump administration has initiated multiple investigations into claims of fraud within Minnesota's child care system, particularly focusing on the alleged misuse of taxpayer funds. This week, the Department of Health and Human Services implemented a freeze on $185 million allocated for child care in the state and established additional verification requirements for businesses seeking reimbursements. These steps are described as efforts to address what officials say has been a long-standing issue of funds being diverted improperly. Minnesota Democrats, including Governor Tim Walz, have responded by emphasizing their commitment to combating fraud through system improvements and holding accountable those involved. They have also expressed frustration, suggesting that the federal actions may be motivated by political considerations rather than solely administrative ones. In related developments, several child care centers operated by members of the Somali community in the Twin Cities area have reported receiving threatening messages and experiencing security incidents since a viral video brought national attention to the issue. For instance, one center, Nokomis Daycare, reported an attempted break-in where an individual allegedly cut through a cinder block wall to access the office and remove documents containing information about the children in their care. Police are investigating this incident, though no arrests have been announced. While this specific center was not featured in the viral video created by an individual named Nick Shirley, it was among dozens identified earlier this year by state investigators for receiving over $1 million in federal funding despite documented repeated violations. The fraud allegations have been known at the state level for several years, but have only recently gained broader national visibility. Moving from these reported events, let's examine the broader context surrounding the Trump administration's involvement. From a policy standpoint, the decision to freeze funding and impose new verifications appears tied to long-standing concerns about oversight in federal aid programs. Political analysts believe this action aligns with the administration's emphasis on fiscal accountability, particularly in areas where federal dollars intersect with state-managed social services. Historically, similar interventions have occurred when federal agencies identify patterns of potential misuse, such as in welfare or education funding, aiming to prevent escalation without fully halting programs. This could signal a strategic approach by the administration to address what they describe as systemic vulnerabilities in how states distribute childcare subsidies. For example, the allegations center on reimbursements that may have been inflated or improperly claimed, often involving centers serving immigrant communities. In Minnesota, which has a significant Somali American population, these programs are part of the Child Care Assistance Program funded partly by federal block grants. The administration's steps, such as the funding pause, are presented as temporary measures to allow for audits, but they also highlight tensions between federal oversight and state autonomy in administering aid. Shifting to the reactions, media coverage has varied, with some outlets framing the investigations as necessary checks on public spending, while others point to potential overreach. Analysts from think tanks like the Heritage Foundation or the Center on Budget and Priorities Planners might interpret this differently. Conservative-leaning experts could view it as a corrective to lax enforcement, whereas progressive ones may see it as disproportionately affecting vulnerable populations. Institutions such as state legislatures and federal watchdogs like the Government Accountability Office are likely to monitor these developments closely, potentially leading to reports or hearings that clarify the extent of any irregularities. From a broader perspective, the involvement of a viral video in amplifying these issues underscores how social media can influence policy agendas. The video in question reportedly detailed specific claims of fraud, drawing parallels to past instances where online content has prompted official responses, such as in election integrity debates or public health funding. This matters because it illustrates the interplay between grassroots reporting and governmental action, where unverified claims can accelerate investigations but also risk stigmatizing entire communities. In this case, the Somali childcare centers have noted that the attention has led to unintended consequences, like increased threats, which community leaders attribute to misinformation spread online. Explaining the potential motivations, the administration's focus on Minnesota may stem from its status as a key battleground state, with a history of debates over immigration and social welfare. Trump has previously highlighted issues related to Somali immigrants in public statements, often in the context of economic impacts or security. This latest move could be seen as part of a pattern where federal resources are redirected to scrutinize programs perceived as inefficient, similar to past efforts during his first term targeting sanctuary cities or certain aid distributions. Analysts suggest this approach aims to reinforce narratives around government efficiency, though without direct evidence of partisan intent in the official announcements. In terms of impact on U.S. politics, these actions could influence discussions in Congress about reauthorizing childcare funding under laws like the Child Care and Development Block Grant Act. If the investigations uncover substantive fraud, it might bolster arguments for stricter national guidelines, potentially affecting how billions in annual federal aid are allocated across states. Conversely, if the pause disrupts services without clear justification, it could fuel debates over equity in social programs, particularly for low-income families reliant on subsidized care. From an institutional angle, this might prompt the White House to coordinate more closely with states on fraud prevention, possibly leading to updated protocols that balance accountability with service continuity. Historically, similar situations have shown that federal funding pauses can lead to negotiated resolutions, as seen in past disputes over Medicaid or education grants. For instance, during the Obama era, investigations into state-level fraud in food assistance programs resulted in enhanced data sharing between federal and state agencies. Here, political analysts believe the current scenario could encourage Minnesota to accelerate its own reforms, such as those mentioned by state officials, to restore full funding. This could also affect public perception of the administration's priorities, with some viewing it as proactive governance, while others as selective enforcement. Analytically, these developments could reshape how federal and state governments collaborate on social welfare oversight, potentially leading to more standardized verification processes nationwide. This might signal a shift towards greater scrutiny of community-based programs, influencing funding decisions in upcoming budget cycles. From a societal viewpoint, the reported threats to childcare centers highlight risks associated with heightened public attention, which could prompt discussions on protecting vulnerable groups during investigations. In the political realm, such actions might affect interstate relations or inform policy platforms in future elections, though without speculating on outcomes. Institutions like the Justice Department or congressional committees may become more involved if allegations escalate, fostering a framework for addressing similar issues in other states. The Trump administration's investigations into Minnesota's childcare programs represent a focused effort to address alleged fraud through funding adjustments and enhanced checks. The facts indicate a temporary freeze on significant funds amid state-level concerns and community impacts. The analysis points to contextual factors like fiscal accountability and media influence, with potential effects on policy and intergovernmental relations. Overall, this situation underscores the complexities of managing public aid programs in a federal system.